All right, picture two totally different scenarios. On one hand, you've got a high-speed motorcycle crash. Pretty dramatic, right? On the other, a simple slip and fall on the pavement. I mean, they couldn't seem more different. But what if I told you that both of these accidents could lead to the exact same kind of devastating, hidden injury? The kind that's so sneaky, even doctors have a really tough time spotting it at first.
So, that's what we're going to dive into today. We're going to explore what happens when the real damage from an accident is completely invisible to the naked eye. What kind of serious, life-changing problems could be hiding just under the skin after what looks like a totally straightforward fall or crash? So here are our two case studies, side by side. On the left, that high-impact collision, and on the right, the fall, the classic falling onto an outstretched hand. They look worlds apart, but we're about to see how these incredibly different events can set off a chain reaction of really complex medical problems.
All right, let's start with the big one, that high-velocity crash. To really get what's going on here, we need to talk about the arm's, well, its electrical command center. It's this incredibly intricate network of nerves called the brachial plexus.
You can think of the brachial plexus as a massive superhighway for nerve signals. It all starts up in your neck and your upper back, and from there it's responsible for literally every signal that controls movement and sensation in your whole arm. I mean everything, from shrugging your shoulders all the way down to feeling the texture of something with your fingertips. It all travels along this one network.
So, how does a system like that just get unplugged? Well, in a really high-impact crash, your head and your shoulder can be violently yanked apart. This causes what's called a traction injury, basically a massive stretch. The nerves can get stretched, they can get torn, or in the worst-case scenario, they can be ripped right out of the spinal cord. And just like that, all the signals to the arm are cut off. Total shutdown.
Now, what happens next really depends on which part of that nerve highway gets damaged. If it's the upper part of the plexus, you get something called Erb's palsy, which results in this very classic waiter's tip posture where the arm just hangs limp and turned inward. But if the lower nerves are the ones that are hit, you get Klumpke's paralysis. This affects the hand muscles, causing it to curl up into a claw hand. It's kind of wild, right? How damage to the same network can produce such drastically different results.
Okay, let's completely switch gears now. We're moving away from that intense crash and over to our second scenario, the simple fall. And in this case, the hidden danger is all about one tiny, incredibly fragile bone in your wrist. It's called the scaphoid. It's basically the keystone for all your wrist movement, but it's got a fatal flaw.
So how big of a deal is this one little bone? Well, get this. It's responsible for a whopping 70% of all fractures of the carpal bones. Those are the little cluster of bones that make up your wrist. 70%. That makes it by a huge margin the most commonly broken bone in the entire wrist.
The name scaphoid actually comes from the Greek word for boat, which kind of describes its shape. But that shape is part of the problem. You see, this little boat-shaped bone is hiding a secret, a really dangerous design flaw it's built right into its anatomy.
And here it is. This is the scaphoid's Achilles heel. Its blood supply is what we call retrograde. That just means it flows backwards, which is not good. The main blood vessel enters at the far end of the bone, the end closer to your fingers, and then the blood has to travel backwards to feed the part of the bone closer to your arm. It's completely the opposite of how most bones in our body are designed to work.
So you can probably guess what happens when you break it, right? A fracture that goes right across the middle, the waist of the bone, which is the most common break, can act like a pair of scissors. It just snips that one-way road for blood flow. And suddenly, that top piece of the bone is completely cut off, totally starved of the oxygen and nutrients it needs to survive.
This starvation kicks off a really nasty condition called avascular necrosis, and it's as bad as it sounds. Avascular means no blood. Necrosis means death. The bone tissue literally dies because it's not getting any blood. Over time, that dead piece of bone can collapse, leading to crippling arthritis and a permanent loss of function in the wrist.
And this is where our two very different stories, the motorcycle crash and the simple fall, come crashing together. Because for all their differences, both of these injuries share one huge problem. They are notoriously difficult for doctors to spot right away. It's a massive diagnostic challenge.
I mean, this quote from a medical journal pretty much says it all. When it comes to the scaphoid, a doctor can press on it, they can move your wrist around, they can do all the standard checks, and there is still no single physical exam that can reliably say, nope, it's not broken. It's an absolute master of disguise. And the problem doesn't stop there. It goes right into medical imaging too. A brand new scaphoid fracture? A lot of the time it's totally invisible on the first x-ray.
And for the brachial plexus injury, sure, the X-ray might show a broken collarbone, but it can't see those stretched or torn nerves. For that, you need an MRI, which usually doesn't happen immediately. So in both cases, you have these serious injuries just hiding in plain sight.
This puts doctors in a really tough spot. A missed scaphoid fracture could be a disaster for the patient, so they have to err on the side of caution. And the results of that caution? Well, for every 100 people who get put in a cast for a suspected scaphoid fracture, it turns out that up to 95 of them don't actually have one. You're looking at a huge amount of unnecessary treatment, all in the name of catching those 5 or 10 real, hidden fractures. Okay, so after all that talk about how hard these things are to even find, what does the road to recovery look like? Is there good news? Well, yes. Fortunately, modern medicine has actually figured out some pretty clear pathways for healing both of these very complex injuries. Now, the game plan for each injury is totally different. For the brachial plexus, the main goal is to restore nerve function. That means tons of physical therapy, splinting, and sometimes really complex surgeries like nerve grafts or transfers. With the scaphoid, though, the #1 priority is just getting that bone to fuse back together and making sure the blood supply gets reconnected. That usually involves a long time in a cast, or if it's a particularly nasty break, surgery.
But at the end of the day, a successful recovery for both of these injuries really boils down to a few key things. First and foremost, you've got to get that diagnosis right, and you've got to get it early. After that, it's all about the hard work, physical and occupational therapy, to stop the muscles from wasting away and to keep the joints moving. And maybe most importantly, patients have to know this isn't a quick fix. It is a long, slow road to healing. So there you have it. From a violent, high-speed crash to a simple, everyday fall, we've seen how our own bodies can hide some really serious truths right under the surface. And it kind of leaves you with a bigger question, doesn't it? In medicine, and heck, maybe in life in general, are we really listening closely enough to those quiet, subtle signs that are trying to tell us that something is seriously wrong?